All right, so today we're diving deep into something that's really hitting close to home for a lot of people, ransomware, but specifically how it's impacting healthcare.
Yeah, and it's a pretty scary landscape out
For
there.
sure, for sure. We'll unpack why healthcare is such a prime target, the havoc these attacks cause, and most importantly, what can be done to protect all that sensitive data.
Absolutely, because if you're in healthcare or really anyone who just cares about, data security in general, this is something you need to be aware of.
Exactly.
So first things first, we need to understand why healthcare data is like the holy grail for these cyber criminals.
Yeah, what makes it so valuable to them?
Well, think about it. Your medical records, they hold everything from your social security number to insurance details. Your whole identity is basically laid out.
It's like a gold mine for identity theft.
Exactly. And on the black market, this stuff is worth up to, get this, 10 times more than credit card information.
10 times. Wow, that's pretty alarming.
It is, because in the wrong hands, this information can be used to create fake IDs, open fraudulent accounts, even access your financial accounts. It's a nightmare.
It's scary to think how vulnerable our health data really is.
And what makes healthcare institutions even more vulnerable is that, well, let's face it, a lot of them are struggling with tight budgets.
Yeah, and unfortunately, cybersecurity often takes a back seat to patient care.
Right, and that creates a weakness. And these cyber criminals, they know it. They're experts at exploiting these
So we're
vulnerabilities.
talking outdated systems, lack of training, slow response times.
All of that and more. Plus, think about how many people need access to these healthcare systems. Doctors, nurses, admins, technicians. Every single login is a potential entry point for an attacker.
It's like having a bank vault with 100 keys floating around. Someone's bound to find one that fits.
Exactly. And healthcare staff are often overworked, under pressure. They're more likely to fall for a phishing scam or, some kind of social engineering tactic.
They're just trying to help people, and these attackers prey on that.
Yeah, all it takes is a cleverly disguised email or fake phone call, and boom, they're in.
So we've talked about the why, but now let's get to the real-world consequences.
Because it's not just numbers on a spreadsheet. We're talking disrupted patient care, compromised privacy, potentially life-threatening situations.
Okay, so let's talk about some real examples. Remember the attack on Ireland's health service executive back in 2021?
Oh yeah, the Conti ransomware gang, they really hit them hard.
They got in through a phishing email and managed to encrypt something like 80% of their entire IT system.
80%, that's insane.
It was chaos. They were forced to go back to pen and paper for record keeping, diagnoses were delayed, treatments postponed, and a ton of private patient data ended up on the dark web.
The Irish government was monitoring the dark web for months, trying to, contain the damage.
It really shows how these attacks can cripple an entire healthcare system.
Absolutely. And then there was the Yuma Regional Medical Center attack in 2022.
Yeah, where the attackers were actually inside this system for days before they even deployed the ransomware.
Unbelievable.
They were just stealing everything, social security numbers, names, medical records, you name it.
See, that's what's so terrifying about these new attacks. They're not just about getting in and out quickly anymore.
It's about infiltrating, staying hidden, and maximizing the damage.
Right, and healthcare institutions often just aren't equipped to deal with this level of sophistication.
It's like someone breaking into your house, not to steal a TV, but to camp out for a week and go through all your personal belongings.
A perfect analogy. And then remember that attack on that finance company in 2022, the one with the quantum ransomware.
Yeah, the ripple effects of that one were massive. Something like over 657 healthcare organizations were impacted just because they were connected to that company.
Exactly. It's a perfect example of how interconnected everything is. These attackers exploit these connections to gain access to a whole network of victims.
Suddenly, you're not just dealing with medical data, but financial information, addresses, all sorts of sensitive stuff.
In the cost of recovery.
Yeah.
Astronomical, both financially and in terms of the disruption to patient care.
So we're talking disrupted patient care, financial losses, reputational damage, potential legal issues. It's a lot.
It is, but here's the thing. While the threat is real, effective protection is possible.
Okay, so there is hope?
Absolutely, and that's where we come in. At Stonefly, we're dedicated to providing solutions that actually work in the real world. If you want to learn more, you can visit our website at www.stonefly.com or reach out to us at sales@stonefly.com.
So what's the key to protecting ourselves?
Being proactive. Healthcare is a prime target, so we have to accept that an attack is likely at some point.
It's about being prepared, not scared.
Exactly. It's about building a layered defense system that protects your data from every angle.
So how do we build this digital fortress? What strategy should healthcare providers be prioritizing?
2 words: air gapping and immutability.
Okay, break those down for me.
Air gapping is like having an offsite vault for your most valuable data. It's completely separate from your main networks.
Because even if attackers get into your system, they can't touch the air gap data.
Exactly. It's like a backup generator for your data. If the main power goes out, you still have a lifeline.
I like that analogy.
And immutability adds another layer of protection by making that air gap data unchangeable and undeletable for a specific period.
So it's like etching information in stone. Once it's there, it can't be altered or erased.
Exactly. It guarantees you have a clean, untouched copy of your data to restore from no matter what happens.
So even if someone gained access to this separate backup, they couldn't tamper with it or delete it?
Nope, it's protected.
Air gapping and immutability sound like a pretty solid foundation for our fortress. What else can we add to strengthen our defenses?
Well, beyond the technology, your staff is your first line of defense.
Right, the human element.
Exactly. Robust training is essential to help them spot those phishing emails, recognize social engineering tactics, and just follow best practices for data security.
So it's about empowering them to be proactive and vigilant.
Absolutely, because even the strongest fortress can be vulnerable if someone leaves the gate open, right?
Makes sense. So it's about training those guards to be more aware.
Exactly.
So it's about building that security culture, everyone understanding the risks and taking responsibility. Right?
Absolutely. Think of it like a security onion.
A security onion.
Yeah, multiple layers working together to protect that core data.
Okay, I'm intrigued. Walk me through those layers.
So the outermost layer is prevention, stopping those attacks before they can even get in.
So like locking your doors and windows.
Yeah, exactly. Strong passwords, multi-factor authentication, regular updates, firewalls, all those basics.
The essentials.
But they make a huge difference.
Okay, but what about the more determined attackers? The ones who manage to slip through those initial defenses?
Well, that's where the next layer comes in. Detection.
So we're talking about systems that can spot suspicious activity.
Exactly. Things like intrusion detection systems, SIEM tools, security information and event management, EDR solutions, endpoint detection and response.
Jargons galore.
Right. But they're all designed to spot those potential breaches, any sign of malware lurking in your network.
But with so much data flowing through healthcare systems, how do these tools tell the difference between normal activity and a real threat?
Well, they're designed to analyze patterns, behaviors, anything unusual.
So like a security camera that's actually paying attention.
Yes. They're looking for things like, weird login attempts, strange data transfers, file modifications that just don't seem right.
Okay, so it's about spotting those red flags.
Exactly. But let's say something does slip through. What happens then?
That's the worst case scenario, right?
It is, but that's where our next layer kicks in. Response and recovery.
So this is where our air gapping, our immutability, all those backups come into play.
You got it. It's all about being able to quickly isolate infected systems, contain the damage, and restore everything from a clean backup.
So even if they breach those outer layers, we still have that core protected.
Exactly. It's your insurance policy, your guarantee that you can recover without paying a ransom.
That peace of mind has got to be invaluable for healthcare providers.
It is, but remember, technology is only part of the equation.
Right, the human element.
Staff training is absolutely critical. They need to know how to spot those phishing emails, recognize those social engineering scams.
So it's about turning them from a potential weak point into another layer of defense.
Exactly. They become those vigilant guards we talked about.
So what kind of specific training are we talking about?
Start with the basics, recognizing phishing emails, good password practices, knowing how to report anything suspicious.
And then how to deal with those sneaky social engineering tactics.
Right, because those can be really tricky.
So we're really talking about creating a whole culture of security.
Yes, embedding it in the DNA of the organization.
And it's not just a one-time thing, right?
Nope, it's ongoing. Regular security audits, penetration testing, vulnerability assessments, all of that is crucial.
So it's like keeping your castle defenses in tip-top shape.
Exactly. You can't just build it and forget it.
So is this something Stonefly helps with?
Absolutely. We work with providers to identify those vulnerabilities, test their defenses, and develop custom solutions to strengthen their security.
So it's about tailoring those solutions to each individual organization.
Right, because one size doesn't fit all in cybersecurity.
Okay, so we've talked about technology, training, But what about the bigger picture, those long-term strategies?
Well, a key strategy is moving away from a reactive approach to security.
So instead of waiting for an attack, we need to be proactive.
Exactly. Anticipate those threats, build those strong defenses, and constantly test and evaluate your security.
Prepared, not scared.
I like that because ransomware is a real threat, but it's not insurmountable.
Right. With the right knowledge, tools, and partners, healthcare providers can protect their data, their patients, and their whole organization.
Absolutely. Because that trust is essential in healthcare, it's about handling patient data responsibly and ethically.
Safeguarding not just data, but people's lives.
Exactly. And in a world where these attacks are becoming more and more common, that sense of security is crucial.
But let's be real, healthcare providers are already facing so many challenges. Staffing shortages, budget cuts. How can they add cybersecurity to their plate?
It's a valid concern, but cybersecurity is an essential investment.
Because the cost of an attack is way worse.
Way worse. We're talking financial losses, reputation damage, legal issues, and of course, the impact on patient care.
So it's not just about data, it's about people.
Exactly. But with so many solutions out there, it can be tough to know where to start.
It's overwhelming.
It is. So my advice would be to start by assessing your current security posture.
Figure out where you're vulnerable.
Right. Prioritize your risks, and then look for solutions that meet those specific needs.
Don't be afraid to ask for help.
Exactly. Find a trusted cybersecurity partner like Stonefly, someone who can guide you through this.
So it's about finding the right partner, someone who understands healthcare.
Absolutely, because it's not one size fits all. And for more information, you can visit our website at www.stonefly.com or reach out to us directly at sales@stonefly.com.
Great. So we've talked about technology, partnerships, but what about government and policy? What role do they play in all of this?
They're a big piece of the puzzle, especially when it comes to setting those standards, promoting collaboration.
Right, making sure everyone's on the same page.
Exactly, and providing resources to help healthcare providers really step up their defenses.
So we're starting to see more legislation around cybersecurity, right?
Oh, yeah, we're seeing more focus on things like incentivizing better practices, encouraging information sharing, and holding those responsible for attacks accountable.
So it's about creating a more supportive environment.
Absolutely, because healthcare providers shouldn't be left to fight this battle alone.
Okay, but aside from government initiatives, what can individual healthcare providers actually do? I mean, it's easy to feel powerless against these really sophisticated attacks.
Well, like I said, knowledge is power.
Right, so understanding the enemy.
Exactly. Healthcare providers need to educate themselves about ransomware, how it works, what the consequences could be.
So they can make smart decisions about security and training.
Right, and incident response planning, that's huge.
So being proactive, not just freaking out.
Exactly. Understand the threat, assess your vulnerabilities, and then take those steps to mitigate the risks.
Okay, so what are some questions that healthcare providers should be asking themselves to kind of gauge where they're at?
Well, here's a big one. If you were hit with ransomware tomorrow, how confident are you that you could actually recover all your data quickly and completely?
That's a good question to ask.
Right. And do you have an incident response plan? Have you tested it recently? How well are you protecting your most critical assets? Is your staff trained to spot those phishing attacks, those social engineering scams?
Wow, those are some really thought-provoking questions.
Right. They should get the wheels turning.
Yeah, it's a reminder that this isn't just about technology, it's about people and processes too.
It all comes together. It's about building an organization that can actually withstand these attacks and recover quickly.
And it's a constant process, right? Always evolving.
Absolutely. The threat landscape never stands still, so healthcare providers need to stay vigilant, adapt their defenses, and always be looking for ways to improve.
So the big takeaway here is that ransomware is a huge threat, but it's not a hopeless situation.
Nope, not at all.
By taking the right steps, investing in the right solutions, and really building that culture of security awareness, healthcare providers can protect themselves, their patients, and their organizations.
Exactly, and that's what we at Stonefly are here to help with.
Right, providing the tools, the expertise, that support.
We're in this together.
Well, you've given us a lot to think about today, both the technical details and the bigger picture.
It's been a great discussion.
Before we wrap up, any final thoughts or advice for our listeners, those who are dealing with these challenges every day?
Just remember, you're not alone. There are resources out there, partners like us who are dedicated to helping, and a whole community of healthcare professionals who are sharing their knowledge.
Right. Strength in numbers.
Exactly. So don't be afraid to ask questions, seek guidance, learn from each other, and most importantly, stay vigilant, stay proactive, Stay ahead of the curve.
Great advice. Knowledge is power. And the more we all understand about ransomware, the better we can protect ourselves and our patients.
Couldn't agree more.
And for anyone listening who wants to learn more, we encourage you to visit Stonefly's website. That's www.stonefly.com to check out their solutions and resources specifically for ransomware protection in healthcare.
They've got some great stuff there.
You can also reach out to them directly at sales@stonefly.com to speak with one of their experts.
They're always happy to help.
It's about building that impenetrable digital fortress, right?
That's the goal.
Well, thank you so much for joining us today. It's been a pleasure having you.
Thanks for having me. It's been great.
And thank you to everyone listening for joining us on this deep dive into the world of ransomware and healthcare.
Stay safe out there.
Until next time, stay safe, stay informed, and stay protected.